We begin with alarming news on the pandemic front. COVID-19 hospitalizations are on the rise across the country, and that includes our area of Western Mass. Good Wednesday evening, everyone. Thanks for joining us. I'm Chris Pisano.
And I'm Jordan Jagalinzer. Western Mass News reporter Baystate Health is getting answers from a medical expert on what this means as we approach the holiday season. She joins us live in studio with more. Baystate?
Yeah, well, Chris and Jordan, definitely alarming. Baystate Health says COVID-19 hospitalizations are on the rise this month, and now doctors are reaffirming their call to get vaccinated ahead of the winter season. More hospital beds are being filled by COVID-19 patients across the country.
It's a wide range of ages. I was just looking at the current population that's admitted in the hospital. We have an average of about 60 years of age.
Closer to home, Baystate Health has seen a spike in hospitalizations since the beginning of the month. On November 3rd, there were 40 patients admitted due to COVID-19. 3 weeks later, on November 17th, it's up to 65 patients. Meantime, during that same period, the number of patients in the critical care unit remained between 5 and 9.
Certainly, there's a group of people from 20 to 30% who had been previously vaccinated, at least by history. And so therefore, they were, it is a case of a breakthrough infection. But most of the hospitalized patients right now are not vaccinated.
Western Mass News digging deeper into the hospitalizations across the country. According to the Centers for Disease Control and Prevention, between November 1st and 7th, there were just a little over 5,000 COVID-19 patients admitted. The next week, there were over 5,300 patients. This is an increase of 5.4% from the prior 7 days. Dr. Armando Paez, the chief of infectious diseases at Baystate Medical Center, says this is in part because many large gatherings have moved indoors with temperatures getting colder. He is reminding residents vaccinations are the best form of protection.
That means vaccination and getting booster shot if you're eligible. If not, as I said, wearing a mask, social distancing, and again, avoid really crowded areas.
In addition, he says getting children ages 5 to 11 vaccinated is very important ahead of holiday gatherings.
Because kids can get sick, but not very sick to be hospitalized, but they can still transmit the infection to the group and household.
Now, coming up at 6, we're getting answers on the Pfizer COVID-19 pill, where its emergency use authorization approval stands, and how it could lower your chances of getting hospitalized. For now, reporting live in studio, Baystate Health for Western Mass News.